What a cure for stomach gases. Tips for dealing with abdominal gases. You can reduce the annoying stomach gases by changing the diet, taking the necessary medicines, and reducing the ingestion of air, and the following is an explanation of these matters in some detail. Changing the diet. Some foods increase gas production and thus increase the likelihood of bloating, and accordingly, reducing the intake of these foods may help the patient get rid of bloating, so the patient is encouraged to write down the names of all the foods and drinks that he consumes and drinks, to find out which of them may causes bloating, and examples of these foods include sugars. It is recommended to reduce them because they can be easily digested and broken down in the digestive system. Dry legumes, fruits and bran that contain fermented carbohydrates, and it should be noted that the problems caused by fermented carbohydrates are not limited to the production of more gases only, but also stimulate the germs to develop tooth decay, and therefore reducing the intake of these foods gives the patient many health benefits. Milk and its products. Some people with lactose intolerance may notice an improvement when reducing the intake of dairy products, and they can be replaced by using milk or its products that are lactose-free or low in lactose, as these products have the same nutritional value present in regular milk, and in the event of a complete cessation from drinking or consuming milk and milk products, it is possible to obtain calcium and vitamin D from other sources. Examples: bread, juice, fortified breakfast cereals, calcium and vitamin D supplements. Alcohol. Is worth abstaining completely from drinking alcohol, since it hinders the digestion of food in the intestine, and this, in turn, keeps food in the intestine for a longer period, which leads to an increase in gas production. Fried foods that are rich in fat, as reducing them helps empty food from the stomach quickly, allowing gases to move into the small intestine. Food rich in fiber, as it is advised to avoid eating for several weeks, and then return to it gradually, and in this context, it is recommended to consult your doctor to ensure that you maintain a healthy dietary fiber intake. Reducing the intake of foods rich in sulfur compounds, especially if they smell of gases, is annoying, and these foods include broccoli, Brussels sprouts, cabbage, and cauliflower, and it should be noted that foods that contain high levels of protein may also cause the appearance of an unpleasant smell of gases, which needs to be alleviated. Other types of foods and drinks that should be reduced, like whole grains, artificial sweeteners, and soft drinks. Lifestyle modification. Following certain patterns and practices may contribute to reducing the problem of stomach gases, including the following: exercising after eating, as this is an effective way to reduce bloating and discomfort that a person feels after eating meals. Although many people feel the urge to take a nap after eating a large meal, it is better to replace the nap with walking for 10 to 15 minutes, and it is indicated that aerobic exercises, including walking, jogging, and gymnastics, will help the gases pass more quickly through the digestive system. Avoid lying down after eating. Although the person feels better when lying down, this position contributes to reducing the body's ability to pass gases and retain gases in the body. Doing certain exercises. In some cases, people who suffer from the separation of the muscles of the abdomen known as the abdominal muscle separation, or those who have undergone abdominal surgery, may have difficulty passing gases through the digestive system, due to the role played by the stomach muscles in transporting gases through the intestine. In these cases, abdominal exercises or walking can help pass gases through the digestive system. Controlling stress and stress, as they may affect the digestion process by affecting the nerves in the digestive system, and therefore taking the means that can control them, including regular exercise, will help alleviate these problems and thus improve the digestion process and relieve puffiness. Avoid practices that cause you to swallow large amounts of air, such as avoiding chewing gum, smoking, eating hard candy, wearing ill-fitting dentures, swallowing food instead of chewing, drinking liquids while eating, sipping hot drinks, and drinking liquids using a drinking straw. An indication that eating quickly will cause the problem of gas as well, and in cases where a person has difficulty slowing down the speed of eating, some measures can be taken that help him to do so, such as putting the spoon aside after each bite of food until the bite is chewed and swallowed completely. Take measures to treat and control health conditions that accompany swallowing large amounts of air, such as chronic postnasal drip, chronic pain, and anxiety disorders. Eat small amounts of foods, as most of the foods that cause gas production are part of a healthy diet, and to verify this, you can eat small amounts of these foods and then monitor the body's response to that. Treatment of cases that cause gas. Some health problems affect the digestive system, causing bloating, and gas is one of its symptoms, and the treatment depends on the nature of the case, its severity, and the symptoms that the patient suffers from, and in general, problems that affect the digestive system can be treated in several ways, and the following are some health problems that cause gas and bloating and ways to treat them. Constipation. Constipation can be relieved and prevented from occurring by following some measures, among which we mention the following: add fiber to the diet. Get regular exercise. Walk 4 times a week, for 20 to 30 minutes each. Drink plenty of fluids, and it is recommended to drink them during meals, with fiber supplements, and during different times of the day. Inflammatory bowel diseases and irritable bowel syndrome. Experts have created a diet suitable for irritable bowel syndrome, also known as IBS patients, to reduce gas and bloating, and it is called a low Fodmap diet. The term Fodmap is an acronym for a group of food molecules known as fermentable carbohydrates that are found in many foods such as fruits, wheat, and dairy products, and it is worth noting that these molecules are difficult to digest, which leads to their undigested transmission to the colon to be a food source for bacteria, and as a result of the bacteria digesting these molecules, a person feels bloated and the accumulation of gases. So patients with IBS notice the irritant that staying away from foods that contain fermentable carbohydrates may help relieve symptoms, and from here the importance of a low Fodmap diet came to light, but it should be noted that this type of diet is considered restrictive and difficult to follow. Therefore, it is worth seeking the help of a nutritionist if you want to follow it, to be able to obtain the nutrients that the person's body needs. Celiac disease. Celiac disease or celiac disease is a disease that affects the digestive system so that the intestine cannot absorb the gluten found in wheat, barley, and corn, and eating foods that contain gluten causes people with celiac disease to suffer from some problems. This includes diarrhea, abdominal pain, fatigue, and it should be noted that there is no complete cure for this disease, but a gluten-free diet can help relieve the symptoms of the condition. Products that eliminate unpleasant odors. The use of products that remove unpleasant odors, such as underwear made of carbon fiber, but they are expensive, and you can use charcoal-lined pillows, but they may not be effective in some cases. Psychological treatments. Psychological treatments can be used for people who cannot tolerate the number of natural gases in the stomach, in addition to people who suffer from excessive belching, especially if the belching is caused by swallowing air, and among the psychological treatments used in these cases, mindfulness treatment, cognitive behavioral